Okay, my apologies. Just make sure that this is recording. Okay, so my apologies. Sorry, I had somebody at the door. Let me go back to my screen share and back to the latissimus. So again, like I was saying, the third action of the latissimus dorsi is internal rotation of the shoulder. Okay. It has a fourth action also because of its insertion. I'm sorry, my apologies. Because of its origin on the inferior angle of the scapula, it also does scapular depression. So it brings the scapula downwards, just like the lower trapezius does. So these four actions are imperative that you know that it is a major shoulder extender. It adducts the shoulder. It internally or medially rotates the shoulder. And it also does scapular depression. That scapular depression is one that students kind of forget because they do forget about the origin at the inferior angle. That's why it's very important for you to know all four of the origins that latissimus has. At the iliac crest, the vertebra from T7 to L5, lower four ribs, and the inferior angle of the scapula. My note on the bottom is that because this muscle adducts and extends the shoulder, it is a strong pulling muscle, like when we are rowing or performing pull-ups. So this really is one of the major movers for when you are performing pull-up exercise. Okay, so origins, iliac crest, vertebral spine from T7 to L5, the lower four ribs, and the inferior angle of the scapula. It inserts into the bicipital groove. Remember, the bicipital groove is also known as the intertubercular groove. Those are two terms that you'll need to correlate together. And that is found on the anterior side of the humerus. Okay, its innervation is the thoracodorsal nerve. Okay, so let me out of that. So we've gone through some of the muscles. So we're going to talk about erector spinae. We've spoken about some muscles of the back already, like latissimus. So now we're going to go into some of the deeper muscles of the back. You're not going to need to know all of them. I'm going to want you to understand, like when we talk about multifidus. Multifidus is a very, very small set of muscles that I will not put on an exam, but I do want you to know basically how that muscle performs its actions. So let's continue on. So like I said, the multifidi muscles, these are a series of small muscles that attach on the vertebra. And what I want you to know about this, as you can see, there's no star next to it, so it's not a muscle that is going to be on any of your exams. But if you hear about the multifidi, what I want you to understand and know is that it is an extender of the vertebral column. So it helps extend the vertebral column. And the way the muscle is, the locations of it is that it spans 2 to 4 vertebrae. So it goes from one muscle of, I'm sorry, my apologies, from one vertebra above to somewhere below it, 2 to 4 vertebrae away from that area. So these are small muscles that basically go from the cervical area to the lumbar area and allows for extension of the vertebral column. Again, this is a muscle that I will not put on your exam. I just want you to know of it. All right. So when you hear a multifidi, small muscles, they span 2 to 4 vertebrae, and they perform extension of the vertebral column. Going backwards. Apologies. The next muscle is a really, really important muscle. This is the Quadratus Lumborum. And you can see with the line in red where it's pointing to, I'm going to circle the muscle. It's this muscle right here in the back. It's coming from the rib area there and going down towards the pelvis. This does have a special layman's term for it. And it's an important muscle for when we have problems ambulating. So the Quadratus Lumborum, it has its origin down here on the iliac spine. All right, so here's its origin right here, and it inserts up here on the ribs. Okay, it inserts right in this area here on the ribs. So what happens is, again, the insertion comes closer to the origin like that. So I want you to know where the origin and insertion are. All right. I'm not going to ask you about the innervation of this muscle. All right. So one less innervation that you have to worry about. But the action of this muscle is what is so important. All right. The Quadratus Lumborum, when they work together, helps with lumbar extension, excuse me. It helps with laterally flexing the trunk to one side. But the most important action that this muscle does, it is known as the body's hip hiker, because it elevates the pelvis on one side. You're going to learn in kinesiology that the pelvis is very important in ambulation. What happens sometimes when somebody has a weak gluteus medius, so you don't have to remember this now, you'll have to remember it in kinesiology. If you have a weak left gluteus medius, what'll actually happen is the right side, the right hip will actually drop. This is known as a Trendelenburg gait pattern. Okay. Now, if you remember back in the Zoom meeting number 3, I spoke about the Trendelenburg position being the position where the head is lower than the pelvis. The head is on a slant. Well, you also will have to know in the second class about the Trendelenburg gait. It's where the gluteus medius muscle of the hip is weak on one side and the hip drops on the other side. Well, what happens is, again, the body tries to compensate. Okay. So one of the compensations for a weak gluteus medius is where the Quadratus Lumborum will actually hike that hip up on the right-hand side. Hence the name, the hip hiker muscle, because it elevates the pelvis on one side of the body. So again, what I need you to know about the Quadratus Lumborum is that its origin is on the pelvis. It's on the iliac crest. Its insertion is on the ribs and the lumbar vertebra. And its main job is to hike up the hip or elevate the pelvis on one side. Okay? When you get into kinesiology, you're going to be using all of these muscles, and it's important to understand them, because once in kinesiology, when I'm teaching it, I'm not going to be reteaching the muscles again. Okay, the muscles, I mean, we're going to be going over the muscles again in the intro class. So you're going to have to know them, because in kinesiology, you're going to be using the muscles to describe movements. And this is a concept in kines that's very, very important as part of the gait sequence. Like I said, the pelvis is very important. It's got to remain level in order to advance your legs. And again, if you have a weak muscle in your pelvis area, specifically the gluteus medius, it actually, when you have, again, a left gluteus medius that's weak, the right side will be affected. The right side will drop. And that will really cause complications when your patients ambulate. So what the patients will do, they'll either circumduct their leg and bring it around, or they'll hike their hip up. And the muscle that performs that hip hike is the Quadratus Lumborum muscle. So this bottom part right here, you need to know, and the origin and insertion. Those parts you truly need to know when we're talking about the Quadratus Lumborum muscle. Again, this muscle is very, very important in the aspect of gait, because it is it's used to compensate, used to perform compensations when a patient is having difficulty with weakness in their hip muscles. So again, the Quadratus Lumborum, the body's hip hiker muscle, because it elevates the pelvis on one side of the body. So this screen is basically showing you the muscles that help move the thoracic and lumbar vertebra. So if you take a look at the middle portion of this picture, there's a person in the neutral position. So if we start with letter A on the left, they're starting in an extended position. So as you can see, their body is in extension. This is extension. And in order to bring their body back to this neutral position, they have to flex. The muscles that flex the trunk and the lumbar area are the rectus abdominis and the iliopsoas. I would just put iliopsoas. Remember, we spoke about, I believe I'm kind of forgetting now with the muscles that we're gone over. The iliopsoas is the combination of the iliacus and the psoas major. So those are the two muscles that flex the body in order to return it from an extended position. On the other hand, this person is flexed. They're flexed over at the trunk. In order to go back to the neutral position, which is letter B, we need back muscles to perform it. So remember the extenders we talked about, the erector spinae, the multifidus, but also another set of extensors at the hip is the gluteus maximus, which is a major hip extensor also. So in order to go forwards and flex, we need muscles on the anterior side to work, to contract, hence the rectus abdominis and the iliopsoas. In order to extend, we need muscles on the posterior portion of the body, and that's where the erector spinae, the multifidus, and the semispinalis from the erector spinae worked together with the gluteus maximus in order to extend the hip and the lumbar area. So just a pictorial of how flexion and extension work in the thoracic and the lumbar area. Remember, we also have some other movements. We have lateral flexion, where, as you can see in letter D here, how this person is flexing to one side. They're coming down in this direction. All right. And remember, some of the lateral flexors are the internal and external obliques. The Quadratus Lumborum also does a bit of lateral flexion. And the hip muscles, the glute medius and glute maximus, are the major lateral flexors, bending to one side. On letter E, the picture on the right, we're looking at someone that is rotating. And remember, when we spoke about rotation, we really spoke about the internal and external obliques. So here in this picture, we have someone that is rotating to the left. So when we rotate to the left internal oblique contracts, because the internal oblique contracts to the ipsilateral side. And in order to rotate to the left, the right external oblique contracts. Because remember, the external oblique rotates to the contralateral side. So again, in order to turn or rotate to the left internal oblique muscle will contract, and the right external oblique muscle will contract in order to perform that left rotation. Okay, so please understand those concepts. Let me do that. Okay. So we have a lot of muscles that act on the shoulder from the upper limb, and they're kind of thought of in compartments. All right, and you're going to see these compartments, especially in the lower extremity. But these compartments are separated by connective tissue known as fascia. All right, each of these compartments contain related muscles, and a lot of these muscles within these compartments will have the same nerve and blood supply. Okay, so I'm actually going to stop this for a second. Again, let me pause. Okay, we're back again. My apologies. I'm home today working. A little foot issue going on. So again, a lot of these muscles are within the same area. They have a lot of the same nerve and blood supplies. And again, there's this fascia that separates the compartments. And sometimes we have disease processes known as compartment syndromes, where one or all of the muscles or other structures like nerves and blood vessels could be injured within specific compartments. So we have these compartments on both the upper and the lower limbs. So let's out of that. Um, when we're talking about the muscles that act on the shoulder, this is a very important aspect of our job function as physical therapist assistants. We do a lot of work on the shoulder because there's a lot of injuries to the shoulder and a lot of different disease processes that we work with as physical therapist assistants. So you're really going to need to know the muscles of the shoulder region. Now, when we're talking about these muscles, most of them originate on that axial skeleton. Remember when we spoke about the bones on day one, that the axial skeleton is basically the base structure of the body. You know, it consists of the cranium and the vertebra and the pelvis. Well, these muscles are coming from the sternum. They're coming from the clavicle area, and they attach onto the humerus and the scapula. So it's very, very important to understand where these muscles are coming from, what their origin and insertion are, because that's going to tell you what its action is. And again, like I said, the shoulder is one of the most important parts of the body that we work on as physical therapist assistants. Now, when we're talking about the scapula is basically loosely attached to the thoracic cage. It's not a true joint. They call it a false joint, all right, because it has an articulation with the thoracic cage, but it's not a true joint like the humeral head in the glenohumeral fossa or the head of the femur in the acetabulum. Not that true joint. It's considered a false joint, but it allows for an awful lot of movement. Think of your shoulder. You can move it in all kinds of directions. And that's a ball and socket joint. But so is the joint at the hip. Between the femoral head and the acetabulum is a ball and socket joint. But because there's so many muscles, strong, thick, big muscles and ligaments at the hip, you don't get the same range of motion, all right, that you get at the shoulder. All right. So you'll see when we talk about shoulder flexion, we get 180 degrees of shoulder flexion, but at the hip, we only get about 120 degrees. When we do shoulder abduction, we get 180 degrees. We're able to bring it straight over our head. But when we do lower extremity abduction, we only get about 45 degrees. So again, the shoulder itself and the scapula specifically allows for a lot of motion. Now, the scapula, that bone on your back, also has a lot of motion. It rotates. We've spoken how it elevates and how it depresses, and we spoke how it goes in and out. It protracts and retracts. So that we also need to know the muscles that do that. And we've gone over a few of them. Remember, when we're talking about elevation, the upper trap and the levator scapula are two of the muscles that elevate. The muscles that depress the scapula, the lower trap and the latissimus dorsi. The muscles that protract and bring it forward is the pec minor and the serratus anterior, which we'll talk about in a few minutes. And the muscles that retract it and bring it back is the middle trapezius and the rhomboids. So you see, we've already gone over a lot of movement at the scapula. We will talk about rotation more when we get into kinesiology, because the rotation and the upward and downward rotation of the scapula requires the use, and I spoke about it earlier, the use of three muscles. It's known as a force couple. So not something I'm going to haunt you on now. I need you to understand what each specific muscle does before I start to go ahead and now kind of combining the muscles and what they do. Now the clavicle, and we spoke about the clavicle, that's that small S-shaped bone that articulates with the sternum and articulates with the acromion process. Remember, we had the sternoclavicular joint and the acromioclavicular joint. This is known as a strut bone, all right? Because it really does brace the shoulder. It really holds the shoulder in place. The clavicle is a very important bone. Again, it is fractured a lot. I do call it the Tony Romo bone because he has fractured it many, many times, thankfully. I'm sorry, that's just mean. I don't like Dallas. Can't help it. A New Yorker. The clavicle is really an important bone. It is the most fractured bone in the body because it is so small and so thin and in such a, basically a dangerous area. It's just set up, unfortunately, to break. But it takes a lot of force to break it. It's not a bone that's just going to crack just for the sake of it. So again, the clavicle braces the shoulder and helps with movement of the shoulder. So here's some of the muscles we've already gone over. If you look at letter A, you can see the pectoralis major. And again, you can see it coming from the sternum. It's coming from the clavicle and how it attaches to the humerus there. Again, an important muscle in that shoulder area. Letter B is showing the deeper muscle, the pectoralis minor. Which is the deeper muscle to pec major. And remember, this was a muscle that helps with protraction. And it's also a muscle that helps with the stability of the shoulder. Letter C is the muscle known as the subclavius. It's a muscle that you will not have to know, but it's the muscle that's actually below the clavicle and attaches the clavicle to the first rib and allows for stability of the clavicle area. Letter D is an important muscle, which we will be going over, I believe, in a few minutes. This is known as the serratus anterior muscle. This muscle is the major protractor of the body, of the shoulder. This muscle is the punching muscle. So when you see boxers throwing a punch, it is their serratus anterior performing that major movement. All right, it would be the serratus anterior and the pec minor that are protracting the scapula forward to allow for that punching movement, to allow the movement of the scapula to come forward. So those are some of the muscles that we've already looked at. Subclavius will be a muscle that you will not see any questions on. If you see a question on the national exam on that, I'm just going to apologize now. I haven't seen one in the last 6 years. It's not a muscle that we really can work on per se. All right, as you can see, just from its placement, there's not a lot that we can do with the subclavius. But we do have a lot of work with the serratus anterior because there's when that muscle weakens, it actually changes the configuration. It changes the shape of the back. And that's something we will be talking about in kinesiology. So again, the scapula has these motions. So if we look at the top left-hand picture, scapula rotates. It rotates upwards and it rotates downwards. Now, like I said, this is a combination movement, a combination of muscles. So I'm not going to ask you anything about it in intro. We will be going over these force couples when we get to kinesiology because it's a very important concept and it's a concept that they will test you on in the national exam. The picture on the right-hand top shows how the scapula elevates, lifts up, and depresses, comes down. So underneath each of those, it shows some of the muscles that does that action. So when we're talking about elevation, we're talking about the levator scapula. We're talking about the upper trap. We're talking about the rhomboid. The major depressors of the scapula, we're talking about the lower trapezius. Serratus anterior does some depression. And another muscle that is not on there, remember the latissimus dorsi attaches to the inferior angle of the scapula and brings it downwards. The other movements, again, that the scapula does is it does protraction and retraction. So protraction, as you can see by the red arrow, is the bringing forward of the arm, where the scapula comes forward. And the two muscles that perform that major action is pectoralis minor and the serratus anterior, like I said a little bit earlier. Retraction is that gray arrow going backwards. Those muscles is the rhomboids performing it and the middle trapezius that bring the shoulder backwards. So these are the actions and the muscles that perform these actions on the scapula. And it's really important to understand it because the scapula is an incredible, has so much action going on. It's a busy bone. Let's just put it that way. But I'm going to give it a little bit of alliteration. It's busy. It's moving. And it allows for so much motion at the shoulder because everything's basically attached to the clavicle and the scapula itself. And you'll see that in a second. So we've gone over a lot of the superficial muscles already of the back. We've gone over the trapezius. Remember, we have an upper, a middle, and lower trapezius. It helps with stability of the scapula. It helps elevate and depress it, and it helps retract it. The levator scapula, remember, that's the muscle that's coming from the transverse process and comes down to the medial border between the superior angle and the spine of the scapula. That was a scapula elevator. It also helped laterally flex to the same side of the muscle. And the rhomboids, remember the rhomboids come from the vertebra and attach to the medial border of the scapula from the spine of the scapula down to the inferior angle of the scapula. And remember, the rhomboids retract the scapula. So again, when we're talking about rhomboids minor and rhomboids major, I want you to think of it as one muscle. It'll, just one less muscle that you have to worry about. Okay, so know that rhomboid minor is superior to major, but in your thinking, you're thinking the rhomboids do this, and that's it. All right, so think of the rhomboids as one muscle. The muscles that attach to the scapula. So on the left side, again, you can see a lot of the superficial muscles, the traps, the lats, the deltoids. And on the right-hand side, you can see a lot of the deeper muscles. And we're going to go into a lot of these muscles now that attach to the scapula and help with all the movements that the shoulder does. So let's recall some of the movements that the shoulder performs. The shoulder performs flexion, where we bring the arm above our head. It does extension, where it brings the arm behind you. Remember, flexion and extension of the shoulder occur in the sagittal plane. The shoulder does abduction, where we bring our arm out to the side and up, AB, going away from the body, and adduction, going back to the body. That movement, abduction and adduction, occur in the frontal plane, all right, where that fake piece of glass splits the body between the anterior and posterior. Finally, we have rotation of the shoulder. We have internal rotation, bringing the shoulder inwards, and external rotation, where we bring the shoulder outwards, also known as medial and lateral rotation. And rotation at the shoulder occurs in the transverse or horizontal plane. So these are the motions and these muscles that we're going to go over in the next few minutes perform all of these actions. So there's about 9 muscles that cross the shoulder joint and they insert on the humerus. Again, in order to perform all of these motions, flexion, extension, abduction, adduction, and rotation, these muscles have to attach at the humerus. Okay, so they're all going to go to the humerus, somewhere on it. All right. We have pec major that does a lot. Remember, does a lot of things. It's coming from the sternum. So remember this muscle we talked about yesterday right here. It attaches, its origin is on the sternum and the clavicle, and it inserts right over here on the humerus in the bicipital groove. So it does a lot of actions. And remember, we spoke about earlier today, the Latissimus Dorsi on the back here, how it also inserts into that bicipital groove. And remember all the actions that Latissimus did. It adducts the shoulder, just like pec major does. And it internally rotates and it extends the shoulder. So these 2 muscles that we have already gone over are major movers of the shoulder. And all of these muscles that you see on this slide are all movers of that cross over the shoulder joint and move the shoulder in a specific way, in one of those ways that I just spoke about: flexion, extension, abduction, adduction, internal and external rotation. And also, don't forget, we also have that movement known as horizontal abduction, where we bring our shoulder to 90 degrees flexion and elbow flexion. And if we adduct, we're bringing it towards the body. That's horizontal adduction. And if we bring the arm away from the body, it's horizontal abduction. So please don't forget those 2 movements also. Get rid of my pencil. All right. Now, you're going to see a lot of pictures. This picture is a posterior view, and it shows all these colors are origins and insertions of muscles, where these muscles are located. So the pink is where actual origins are, all right? Actual muscle origins, and you can see it. So if you, on the top here, we have the supraspinatus muscle, which sits in the suprascapular fossa. And we have the infraspinatus muscle, which is in the infraspinous fossa. Down here, we have the teres major, and we have the teres minor. Okay. Over here, we have the triceps. Down here is also an area of the triceps. Up here is an area for the long head of the biceps. So as you can see, we also have these pictures help guide you and give you an idea of where these muscles have an origin and an insertion. So this is looking at the posterior view. We're looking at the back of somebody. And we can tell that because the spine of the scapula is basically, we can see the spine of the scapula. also in this picture, you'll also know it by in this picture on how the elbow is here. All right. When you can see the olecranon process right here on the top, on this top area, it tells you that you are looking at it from the back. So these are where the posterior muscles attach to. And the next picture will show the bones on an anterior view. Okay. And you can see the difference. So on the scapula, you know this is an anterior view because there's no spine of the scapula here. All right. This area right here is the subscapular fossa where the subscapularis origin is. And again, with this one, you can tell by the elbow because you can see the coronoid and the trochlea right here on the humerus and its two fossas right here, which is definitely a different look than the posterior view. So this is just another pictorial way that you can get an idea of where the origins and insertions of all of these muscles are. All right, so let's start with these muscles and the four most important muscles probably in the body that we work on. These are known as the rotator cuff muscles. These are four muscles where the tendons of these muscles is the actual cuff itself, not the muscle belly, but the tendons. And what happens is that these tendons go over the humeral head and protects and keeps the humeral head in the glenoid fossa. That is the job of the rotator cuff muscles, is to keep the humeral head in the fossa, in the glenoid fossa. The four muscles that make up the rotator cuff has an acronym. The acronym is SITS, and it's made up of the first letter of their names. Going from S to S, the first three muscles are on the posterior side of the body, and the fourth muscle is on the anterior side of the body. So, supraspinatus is the first muscle. Infraspinatus is the second. Teres minor is the third of the rotator cuff muscles. Those are on the posterior side of the body. The last S is the subscapularis muscle, and that's located on the anterior side of the body. Each of these muscles have an origin on the scapula itself. Each of these muscles has an origin on the scapula. The first three muscles, supraspinatus, infraspinatus, and teres minor, have an insertion on the greater tubercle of the humerus, and the subscapularis has an insertion on the lesser tubercle of the humerus. Most of these muscles have different actions. You're going to need to know everything about these four muscles. So it's called the rotator cuff because, like I said, the tendons merge with the joint capsule of the shoulder and they cross the head of the humerus. Just like I said, the major job of these four muscles is to hold the head of the humerus into the glenoid cavity. That is the most important job. That is what they do as a group. They each have separate actions, But when we're talking about the rotator cuff, the job of the rotator cuff is to keep the humeral head in the glenoid cavity. Like I said the other day when we talked about an impingement, the supraspinatus muscle of these four is the most easily and the most damaged muscle because it can be impinged. And what I mean, and it's something you will learn in kinesiology. And I kind of showed it to you the other day. If you have your arm down to your side with your thumb downwards, and you were to abduct your shoulder, you could only bring it up to a certain amount, and it would literally stop. But if you rotated your thumb upwards and did that same movement, you can bring it all the way up. You can get an extra 40 to 50 degrees. With your thumb down and you move, you're actually impinging the supraspinatus muscle. It's actually hitting the acromion process, which keeps it from being allowed to contract. So that's one of the things that you'll actually be looking for when you're educating a patient to make sure that they're performing their exercises correctly. All right, that's one of our jobs as physical therapist assistants, is to make sure that patients are doing things correctly so they're not hurting themselves. So let's go through each of these muscles. Let me go back one. So again, if we look on the anterior side, this is a little tricky picture, unfortunately. The anterior side only has one muscle of the rotator cuff. So the subscapularis is the anterior muscle. So it's right here. And it's this muscle here, right on the front side here. All right, that muscle right there. On the posterior side, we have the three muscles. We have the supraspinatus, which is up here. As you can see, here's the acromion process. You see how close it is, how the supraspinatus is so close. Not a lot of room there for movement, okay? You have the infraspinatus, and you have the teres minor down here on this side. All right, so if you follow these arrows from this area here and this area here going this way, these muscles are on the posterior side, on this back side right here. So again, the muscles of the posterior side on the rotator cuff, supraspinatus, infraspinatus, and teres minor. The fourth muscle is on the anterior side. That is the subscapularis. All right, let's go over each one of these four muscles. The first muscle is the supraspinatus. And again, you have got to know these muscles cold. Cold, you've got to know them. The origin of the supraspinatus is the supraspinous fossa. Remember, on the scapula, above the spine of the scapula, there is a small fossa, a small space. It is known as the supraspinous fossa. The muscle that sits there is the supraspinatus muscle. As you can see from the picture, the muscle goes underneath the spine of the scapula. Here is the acromion process, like I said, and it's this proximity to this bone that makes the supraspinatus the most injured, the most impinged muscle of the four rotator cuff muscles. The insertion of supraspinatus is the greater tubercle of the humerus. So if this is the greater tubercle of the humerus, the supraspinatus, the infraspinatus, and the teres minor all attach to that area. And they attach basically in a row. Supraspinatus on the top, infraspinatus in the middle, teres minor more posterior. But they sit next to each other on the greater tubercle of the humerus. So the origin is the supraspinous fossa of the scapula. It inserts into the greater tubercle. It's innervated by the suprascapular nerve, the suprascapular nerve. This muscle, if you were to kind of palpate it, goes from medial to lateral. It goes in this way here. It goes in this direction. So just by the direction, if you were to bring, so again, like I said, you've got to look at things in a three-dimensional way. So here's the insertion right here on the greater tubercle, and here's the origin. So what you need to picture is if the insertion is moving this way towards the origin, it's going to make the humerus go out to the side. Okay, so just by knowing how a muscle works is going to give you an idea on what its job is. So the major action of the supraspinatus muscle is that it initiates shoulder abduction. It does the first 30 degrees of shoulder abduction. What that means is if you have your arm down to the side, the initial movement of abduction, the first 30 degrees, is performed by the supraspinatus muscle. After the 30 degrees, then the middle deltoid comes in to do the rest of the motion. So the supraspinatus, most impinged muscle of the rotator cuff, its origin is the supraspinous fossa of the scapula. It inserts onto the greater tubercle of the humerus. Its innervation is the suprascapular nerve. Its action is to abduct the shoulder, and it specifically does the first 30 degrees of shoulder abduction. Excuse me. So the supraspinatus muscle, very important, most impinged muscle. Its main action is shoulder abduction, and it specifically does the first 30 degrees of shoulder abduction. The eye of the sits muscle is the infraspinatus. The infraspinatus comes from the infraspinous process. So if we were to take this muscle away, there would be a space here underneath the spine of the scapula. That's the infraspinous fossa. The infraspinatus sits in that fossa. This is the origin. The insertion is here on the greater tubercle, just like supraspinatus. This has the same innervation as supraspinatus. So supraspinatus and infraspinatus are the same innervation, both the suprascapular nerve. This muscle, its action is to laterally or externally rotate the humerus. So again, so here's a muscle that's on the posterior side, and here's its insertion. When that insertion comes closer to the origin, it turns the humerus, allows the humerus to rotate. So infraspinatus rotates the humerus or rotates the shoulder laterally or externally. Supraspinatus abducts the shoulder. Infraspinatus externally rotates the shoulder or laterally rotates the shoulder. Remember its origin and insertion. Origin is the infraspinous fossa. It inserts into the greater tubercle, just like the supraspinatus. But infraspinatus has a different action. The T muscle. Now, we'll come back to the teres major. Please understand this. The teres major is not a rotator cuff muscle. It is not a rotator cuff muscle. There are only four: supraspinatus, infraspinatus, teres minor, and subscapularis. There is only four. So we're going to look at teres minor first. All right, that's all the information is here on this side. So teres minor has its origin on the lateral border, but it's the upper 2/3 of the lateral border of the scapula. It inserts, again, just like supraspinatus and infraspinatus, into the greater tubercle of the humerus. Inserts into the greater tubercle of the humerus. So now we've got three muscles. Three. Yeah, I'm a college teacher. We have three muscles that attach to the greater tubercle: supraspinatus, infraspinatus, teres minor. And again, they go in order. They go in order. Just like infraspinatus, remember, infraspinatus is coming from this area here and inserts here, same area. Teres minor and infraspinatus do the same action. It externally or laterally rotates the humerus. Teres minor has another function. It also helps with adduction, just like pec major and just like latissimus. It's not a major mover of that movement. Okay, not a major mover of that movement. More important is that you know that teres minor is an external or lateral rotator of the humerus. Okay, so far, the three muscles that we talked about, supraspinatus does abduction of the shoulder, first 30 degrees. Infraspinatus and teres minor does lateral rotation or external rotation of the shoulder. Remember, supraspinatus and infraspinatus have the same nerve innervation, the suprascapular nerve. Teres minor, though, has a different one. It's the axillary nerve for the teres minor. Okay, so teres minor comes from the lateral border, the upper half of the lateral border. It inserts into the greater tubercle, just like supraspinatus and infraspinatus. It has a different innervation than supraspinatus and infraspinatus. Teres minor has the axillary nerve. And the teres minor action is the same as the infraspinatus. It externally or laterally rotates the humerus. I'm going to go to the next PowerPoint, then I will come back to this slide. The fourth of the rotator cuff muscles is the subscapularis. Now remember, I said that the SIT, supraspinatus, infraspinatus, and teres minor, all three are on the posterior side. Subscapularis is the only one of the rotator cuff muscles that are on the anterior side. And you can tell that by this picture. All right. Here is the sternum. The sternum is on the anterior side of the body. All right. The sternum is right here in the front. Okay. Subscapularis is an anterior muscle. Okay. It's an anterior muscle. So it's coming from, let's say I had my scapula here. It's coming from here to here, going from the subscapular fossa of the scapula. And this muscle inserts into the lesser tubercle of the humerus. Remember the first three muscles, supraspinatus, infraspinatus, and teres minor, inserted into the greater tubercle of the humerus. This muscle, because it's on the front side, does internal rotation of the shoulder, does internal or medial rotation. So the four muscles of the rotator cuff, supraspinatus abducts, abducts the shoulder, specifically the first 30 degrees. Infraspinatus and teres minor both externally or laterally rotate. Teres minor also does some shoulder adduction, bringing the arm back to its position. And subscapularis does internal or medial rotation of the humerus, or medial rotation of the scapula. I'm sorry, of the humerus. My apologies. Now, you'll find this out in kinesiology, but let me just say this. Remember, I said the job of the rotator cuff is to hold the humeral head in place. It's the four tendons that go over, and they act, I mean, they're actually kind of absorbed by the capsule of the joint. But this is what happens. So these four tendons insert and go over the humeral head, and they hold the glenoid fossa in place. But right above the shoulder, the more superficial muscle is the deltoid. And the deltoid is very, very strong. And what the deltoid tries to do is the deltoid actually tries to pull the humeral head out of the glenoid fossa. So we got these four tendons holding it in, and we got the deltoid trying to pull it out. So that's why the rotator cuff is so important, because it's these four muscles that stabilize the glenoid fossa and keeps the deltoid from pulling the head of the humerus out of the fossa. All right, and causing a distraction and causing the bone to just hang. So these four muscles are imperative that you know. Subscapularis has a different innervation. It's the upper and lower subscapular nerve. So supraspinatus and infraspinatus has the same, the suprascapular nerve. Teres minor is the axillary, and subscapularis has the same name nerve, the subscapular nerve. Okay, so you need to know everything about the rotator cuff muscles. If I was to walk in the hall and say to you, what does the subscapularis do? You should be able to tell me without a problem. And I would go, way to go. All right. You've got to know these muscles cold. You have to. This is a set of muscles that we work with throughout the entire course. And it's a set of muscles that you will see out in the field all the time. All the time. All right. It is a moneymaker for physical therapists and physical therapist assistants. I'm going to go back one to the teres major. Remember, I said that the teres major is not, the teres major is not a rotator cuff muscle. Okay? Not a rotator cuff muscle, because its tendon does not cross the humerus. Its tendon doesn't cross the humerus. Because remember, that's the job of the rotator cuff muscles, is that their tendons cross the humerus and keeps the humeral head in the glenoid fossa. When we're talking about teres major is inferior or below the teres minor. Its origin is at the inferior angle of the scapula. This muscle, like subscapularis, inserts into the lesser tubercle of the humerus. Please notice something, and that's why I put these pictures like this. Here's teres minor inserted on the greater tubercle. It goes from back to back. Teres major, though, goes to the front of the humerus. It inserts on the lesser tubercle. So it has a different movement. It has a very different movement than teres minor. Teres major, its nerve is the lower subscapular nerve. So we have subscapularis and teres major that have that subscapular nerve innervation. Teres major, though, because it inserts on the anterior side of the humerus, teres major performs internal or medial rotation of the humerus. Teres major is kind of also known as a mini lat muscle. It's known as a mini lat muscle. So think of the lat muscle, how the lat muscle comes from the iliac crest, the lower vertebra, the last four ribs, and also the inferior angle. So here's the inferior angle. So latissimus comes up like this, and it too goes to the front, and it goes to the bicipital groove. If you forget what motions teres major does, just correlate it to latissimus. They do the same things. Remember, latissimus also internally rotates the humerus. Latissimus adducts the humerus, and latissimus is the main extender of the shoulder. These are the same three actions that teres major performs. Teres major performs internal or medial rotation. It brings the shoulder back from abduction, and it does shoulder extension. The same actions as the latissimus dorsi muscle. Okay, so that's teres major. Okay, and remember, teres major is not a rotator cuff muscle. Supraspinatus, infraspinatus, teres minor, and subscapularis. Those are the four rotator cuff muscles. All right, get rid of this. All right, so like I said, deltoid is a superficial muscle, and it's probably the strongest muscle of the shoulder itself. So it sits over the supraspinatus, over the infraspinatus, and over the teres minor and the subscapularis. All right, so an expansive muscle, it has, like the trapezius, I need you to treat this muscle as three muscles. For your practical, I will show you a picture like this, and you will say the deltoid. And you will be perfectly correct. Because again, the practical is just going to be an identification of the muscle. On my quizzes, on my exams, the daily exams, you're going to have to differentiate between the three parts of the deltoid. So the deltoid and the trapezius have a lot in common. And I'm going to explain that to you in a second. So again, I want you to think of the deltoid as three muscles in one. This is a 3-in-1 kind of thing, just like trapezius. Remember trapezius, we had an upper trap, a middle trap, and a lower trap. Well, with the deltoid, we too have three parts. We have an anterior deltoid, we have a middle deltoid, and we have a posterior deltoid. And each of them have different actions. Now, like I've said a couple of times before, you're going to see on your flashcards and a lot of other material, other actions of these specific parts of the deltoid. I want to break this down and make it easier and easier to study. The national exam is not going to ask for the middle deltoid and extension, or the anterior deltoid performing abduction. They're going to ask for the main movements. Okay, so what I'm telling you is going to be the best. Okay, it's going to be the best to understand. But understand, you're going to see on some cards and some other information, other movements that it does. I want you to concentrate on the movements that I am giving you. So let's talk about the anterior deltoid first. The anterior delt is right here. It's this section of the deltoid right there. The anterior delt has its origin on the lateral third of the clavicle. Now, haven't you heard that before of an insertion point? Didn't the upper trap have its insertion on that same point? It did. It truly did. Okay? Believe it or not, the insertion points for the trapezius muscles, upper, middle, and lower, are the origins of the deltoid. That is a great way to correlate it. It sounds a little confusing now, but if you remember that, all right, Mr. Dunn splits up the trapezius into into an upper, a middle, and a lower, and he splits up the deltoid into an anterior, a middle, and a posterior. Okay, so he talked about correlating them. Well, the upper trap has its insertion on the lateral third of the clavicle. The deltoid has its origin on the lateral third of the clavicle. The middle trapezius has its insertion on the acromion process. The middle deltoid has its origin on the acromion process. And the lower trap has its insertion on the spine of the scapula. The posterior deltoid has its origin on the spine of the scapula. The insertion point of all three muscles of the deltoid is right here, the deltoid tuberosity. So you can actually correlate the upper trap and the deltoid. I'm sorry, the upper trap and the anterior deltoid. Excuse me. The middle trap and the middle deltoid, the lower trap and the posterior deltoid. Okay? So if you kind of forget, kind of make that correlation, because you only have to know one insertion point because they all insert into the deltoid tuberosity. So again, the anterior deltoid has an origin at the lateral third of the clavicle. The middle deltoid has an origin at the acromion process, and the posterior deltoid has an origin at the spine of the scapula. Well, the traps have their insertions at the same areas. Upper trap insertion, lateral third of the clavicle. Middle trap insertion, acromion process. Lower trap insertion, posterior spine of the scapula, just like the deltoids. All three deltoids insert into the deltoid tuberosity. Its innervation is the axillary nerve. Axillary nerve is the same as the teres minor, I believe, if I remember right. All right, teres minor also has an axillary nerve innervation. Now, each of these muscles have different actions. All right, each of these muscles have different actions. So let's start with the anterior deltoid. The anterior deltoid, it's in the front of the body. Anterior deltoid does shoulder flexion and horizontal adduction. So it does shoulder flexion and it does horizontal adduction. Remember, the other muscles that do shoulder flexion is ABC plus pec major. Pec major. So now you know the A is anterior deltoid. The B is going to be the biceps brachii, and the C is going to be the coracobrachialis. So we've gone over the anterior delt and the pectoralis major as two of the four shoulder flexors. Anterior delt, its main movement is shoulder flexion. Again, it also does horizontal adduction, where it brings the arm closer to the body. The middle deltoid. The job of the middle deltoid is shoulder abduction. Remember, I said that the supraspinatus, one of the rotator cuff muscles, does shoulder abduction, but it does only the first 30 degrees of shoulder abduction. It is the middle deltoid that finishes the job. So the supraspinatus and middle deltoid have the same actions. They both do shoulder abduction. The posterior delt is on the posterior part of the body. There's no way the posterior deltoid can do flexion. All right, it can't do flexion. Flexion is done in the front. But the posterior delt does shoulder extension. Posterior deltoid does shoulder extension and horizontal abduction, where we're going away from the body. So again, the major actions of the deltoid: anterior delt does shoulder flexion, horizontal adduction. The middle deltoid does shoulder abduction. The posterior deltoid does shoulder extension and horizontal abduction. Like I said, you're going to see in some books and flashcards that the anterior deltoid also does abduction, and the middle deltoid does some extension, and the posterior deltoid does some abduction. Don't worry about all of those. Follow what I wrote there. These are the actions you need to know correlated with which deltoid is doing it. You have got to know the origin of each of these parts of the deltoid. Thankfully, there's only one insertion, all right, the deltoid tuberosity. And you got to remember that the deltoid muscle is innervated by the axillary nerve. Okay, so that is everything on the deltoid. The serratus anterior. This is a muscle that's very, very tough to palpate. In ladies and gentlemen that are really well built and have very little fat, not like me because I have a lot of fat, but if you have extra tissue, you really won't see it as well. But on somebody that has very little fat, you will see the serratus anterior when you protract and give it resistance. You will see serratus on the ribs itself. You will not be able to see a lot, but only on the ribs. So the origin of the serratus anterior, and the word serratus means rough, means just rough edges. You know, it has a serratus, you know, when a knife has a serratus, cut. The origin of the serratus anterior is the first 9 ribs, the surface of the first 9 ribs. It inserts onto the medial border of the scapula. What this muscle does is, so you got this muscle on the ribs here, it actually goes underneath the scapula and attaches around onto the medial border of the scapula. A lot of people forget about this muscle, but the national exam truly loves this muscle. They really do like this muscle because they know that a lot of people forget about it, right? So a lot of high-end questions on the national exam uses the serratus anterior. So please know this muscle. Origin, first 9 ribs. It inserts into the medial border of the scapula. It has a major action. We have spoken about it. It protracts the scapula. It brings the scapula forward. So it works with the pectoralis minor as one of the 2 major protractors of the scapula. It does some other things within a force couple, again, which I'll talk about in kinesiology. But what you need to know now is that serratus anterior is a protractor of the scapula. A lot of, like I said, a lot of people forget about this muscle, and I was told this by my own teachers 20 years ago, before I took the test. And they said that a lot of the nerve questions of the shoulder was actually took into account the serratus anterior. So please understand the nerve innervation. So I created my own, again, I talked about acronyms, ABC plus pec major. Those are my shoulder flexors. BBB is my elbow flexors. Well, the serratus anterior has a nerve innervation being the long thoracic. I like salty things. So I used the acronym SALT to remind me that the serratus anterior is the long thoracic nerve. SALT. You'll never ever forget SALT. You really won't. Right? And a lot of my students love that acronym. And actually, my fellow students 20 years ago used that acronym also. It made sense. Easy to remember. So again, what you need to know about the serratus anterior, its origin is the first 9 ribs. It inserts into the medial border of the scapula. It is the long thoracic nerve, hence salt. And it is the major protractor of the scapula. The major protractor of the scapula. Okay. Give me 1 second. Let me see how many we got here. Let's see. It's 3:45 right now. Yep. I'll continue on for a few more minutes. All right. Next muscle is the triceps brachii. All right. Triceps meaning 3. So this is a 3-headed muscle. A 3-headed muscle. You're going to need to know the long head of this muscle and basically the basics of where the other 2 heads are located. The long head of the triceps is at the infraglenoid tubercle of the scapula. Now remember, on the scapula, we have the glenoid fossa. We have a tubercle on the inferior side and the superior side. This inferior tubercle, the origin is the triceps, the long head of the triceps. So the long head of the triceps has an origin at the infraglenoid tubercle, and the medial and lateral head are on the humerus. That's the way you need to know it. The long head origin is the infraglenoid tubercle on the scapula. The lateral and medial heads are on the humerus. The triceps insert into the olecranon process of the ulna, that pointy part where you put the point of your elbow down on the table. Its innervation is the radial nerve. The triceps have 2 main actions, and thankfully they're both extension. Okay? And if you notice, the triceps cross the shoulder and the elbow. So the triceps only do shoulder extension and elbow extension. Remember, Latissimus Dorsi was a shoulder extender. Teres major was a shoulder extender. Well, the triceps is one of the main movers of shoulder extension. Also a main mover of elbow extension. So again, when we're talking about the triceps, you got to know where the long head of the triceps has its origin, the infraglenoid tubercle of the scapula, just below the glenoid fossa. The next muscle is above the fossa. The other 2 heads, the lateral and medial head, are on the humerus. The triceps brachii inserts into the olecranon process of the ulna. Remember, it's the ulna, it's not the humerus. Remember, it crosses the elbow joint. It's the radial nerve innervation, and it extends both the shoulder and the elbow. Backwards. Next muscle is the biceps brachii, and you've got to call it this. The reason is because there is another biceps muscle in the leg. Okay, there is another biceps muscle in the leg. All right. Remember, one of the hamstrings has biceps in front of it. So when you describe the biceps muscle, don't just say biceps. You've got to say biceps brachii because remember, brachii is the word for the humerus, for the upper arm. Bi means two. So this is a two-headed muscle. All right? Two-headed muscle. So it basically has two origins. You need to know these two origins. The long head of the biceps has its origin at the supraglenoid tubercle of the scapula. So again, we have the glenoid fossa. We have the infraglenoid tubercle, where the long head of the triceps is. We have the supraglenoid tubercle, which is where the long head of the biceps brachii has its origin. The short head of the biceps brachii has its other origin on the coracoid process. Remember that finger-looking projection of the scapula. All right, so these are the two origins of the muscle, the two origins. So this is what happens. The long head of the biceps goes through the bicipital groove here. Remember, there's a bunch of muscles that actually go into that bicipital groove. Remember, pec major comes from this side over. Sorry about that. Not from the outside. Comes from the middle over, and latissimus dorsi also comes into that bicipital groove. So the long head goes through the bicipital groove, and the short head comes down the medial side, and they meet at the muscle belly, where you make, when you make a muscle in your arm, that's the muscle belly. The muscle goes down, it crosses the elbow, and it attaches onto the radial tuberosity. It inserts on the radial tuberosity of the radius bone. You're going to see other sources, and it is that has an insertion on the ulnar also. A piece of it is on the ulnar. It is. But its primary insertion is the radial tuberosity. And I have it highlighted on this slide. It's very important. So its insertion is on the radial tuberosity of the radius bone of the forearm. So let's see what this muscle does. It crosses the shoulder, and it crosses the elbow, and it's actually at the forearm also has a crossing. It actually has three actions. The biceps brachii has three actions. So again, the long head of the biceps, its origin is the supraglenoid tubercle. The short head of the biceps has its origin at the coracoid process. The biceps brachii inserts into the radial tuberosity. Its innervation is the musculocutaneous nerve. The musculocutaneous nerve. Like I said, the biceps have three actions. At the shoulder, it does shoulder flexion. It is the B of my acronym. A for anterior deltoid, B for biceps brachii. The C will be the coracobrachialis plus pec major. Those are the four muscles that perform shoulder flexion. The biceps brachii at the elbow does elbow flexion. It is one of the B's of my BBB for elbow flexion. Biceps brachii, brachialis, and brachioradialis. Those are the three muscles that perform elbow flexion. The last action that the biceps brachii does is it supinates the forearm, bringing your palm upwards. It brings your palm upwards. it supinates the forearm. Okay, so the three actions: elbow flexion, shoulder flexion, and forearm supination. Those are the three actions of the biceps brachii. This is a muscle you definitely need to know. It is very, very superficial. You could feel your tendon in the crux of your elbow there. That's the biceps tendon, right before it attaches to the radial tuberosity. This is a muscle you'll need to know. We work on it a lot. I don't want to go all the way there. I think we will stop at the biceps. So let me stop this. It's about 10 minutes to 4 now. Oh, about 5 minutes to 4. So tomorrow we will continue with the muscles. All right, we'll finish the upper body and get to the lower body. Hopefully, I'll try to complete it tomorrow. I'm in no rush to complete it tomorrow, but if we complete it, great. If not, we'll finish it definitely on Monday of next week. Again, we sent the lecture material yesterday, so you should have received that. So I will send this video out as soon as possible. All right, hope everybody has a good evening. And if you have any problems or questions, again, please send me an email. You'll most likely need me to accept you. So if you're ready to watch the video, send me the email for the acceptance, and I'll accept it. Again, I am home right now, for today, working from home. I'll be back in the school tomorrow. So I'll be on my email about every 2 hours or so, as long as I'm home, kind of just like school. And so, again, any problems, please email me. Have a wonderful evening and stay safe and stay healthy. All right. Bye, everybody.